All right, again, welcome everyone to Pre-Health Essentials for first-year students. I'm Emily Nahum, Assistant Director for Pre-Health Advising, and I'm also joined by the other Pre-Health Advisor, Irma Moreno, and she is going to be on chat today, so feel free to ask questions. There are a lot of us here, so just be patient as she tries to answer as many questions as possible. So the agenda for today is that we're going to talk about a variety of different pre-health careers. We might think of pre-med as one of the most popular, but there's definitely a lot of other pathways and schools that are umbrellaed under pre-health. So we're going to kind of talk about those. We're going to go over some general recommendations as you begin your first semester, first year, and as you continue on at Berkeley. And then we're going to talk about academic requirements. That includes some prerequisite courses you might need for some of these pre-health programs, extracurricular activities or other things you can do, ways you can get involved on campus or outside of campus to kind of build a well-rounded amount of experience. We're going to talk about resources on campus here at Berkeley, and then the Berkeley Career Engagement or BCE overview. So I'll just share a little bit more about some of the services that we offer in our department. And I'm really excited because we have some guests joining us today. So we have the Associate Director of Admissions from the School of Optometry, who's going to share a little bit about that program. And then we're also joined by two colleagues at the Biology Scholars Program on campus. So that's going to be a really great way to learn more about other things you can get involved with here on campus. And then time permitting, we'll have a Q&A portion at the end. Again, like I mentioned, you're able to ask questions throughout the presentation and chat, and Irma will be answering those. One thing I want to mention is that this is really an introduction and a brief overview of pre-health pathways here at UC Berkeley. So there will be plenty of time to and opportunities to ask questions and get more information beyond the scope of this workshop. So definitely continue to utilize our services and the rest on campus. So just going to kind of get started with talking a little bit about different pre-health careers. So it's not limited to these that I've listed here, but they can include medicine, dentistry, pharmacy, physical therapy, optometry, physician assistant, nursing, occupational therapy, podiatry, and veterinary medicine. I'd say these are some of the most popular ones that students are interested in, and we have a lot of information on our website about these specific ones. But if there's other health professions that you're interested in or that you're just not sure about outside of these, we can definitely help to kind of explore that with you. All right, so some pre-health pathway recommendations is that grades are important and a strong GPA is encouraged, although a 4.0 is not necessary. So Berkeley classes, especially STEM courses, can be rigorous, and it's important to develop good study habits in your first semester. I strongly recommend going to office hours for some of those more challenging classes. And then I also want to put a plug in for the Student Learning Center. This is an additional resource that has tutoring for specific classes, especially ones that are prerequisite for medical and other health profession schools, like chemistry, biology, math, and so forth. So I would definitely encourage you to check out the SLC. That's maybe what you might hear being called the Student Learning Center during your time here. Meeting with advisors. So Berkeley is a large school with many different types of advisors that can support you for different needs. You have academic advisors, depending on what college you're in. You might have separate college advisors and major advisors, or they might be grouped into one, but they can help you with academic planning for your major and other classes, as well as enrollment. Pre-health advisors like myself and Irma are here in Berkeley Career Engagement in the Career Center, and we can provide support in pre-med or pre-health pathway planning. So definitely utilize your advisors. Another thing is finding balance in your schedule, especially your first semester. So, it might feel like there are so many things that you want to do or feel like you should be doing, whether that's your classes or different activities on campus. There's always so much going on. So, just make sure to not overload yourself with too many technical courses or involvements right away in order to give yourself that space to get acclimated to Berkeley. Another thing is participate in activities that you enjoy, things that are going to, provide fulfillment and joy within your extracurriculars. Some students might feel that they are doing things that feels forced or that they don't really like in order to, because they feel like they should. So just remember to try to do things that make you happy. To continue some recommendations, major in something that interests you. So, medical and other health profession schools don't require a specific major to get in, nor does Berkeley actually have a designated pre med or pre health major or declaration process. However, there are certain majors that might overlap with the prereq classes that you need. That being said, major in something that engages you and will keep you motivated since you'll be spending a lot of time in those classes and striving for strong academic grades. And we can help do some exploration in terms of majors to see what would be a good fit for you if you'd like. Another is flexibility and adaptability. Those are very important qualities. Sometimes life does not go according to plan. A lot of times, students will try to plan out their entire 4 years at Berkeley, but not get into certain classes or clubs the semester that they were intending. So it's important to keep in mind that your plans and schedule might change over the course of your journey here. Make sure to review our Berkeley Career Engagement website for information on medical and health profession schools. We have information on recommended timeline, prerequisite classes needed, and application information. And I've listed there our link to our website. And one quick note that all of the links that are in the presentation slides are hyperlinked. So when you do have access to the slides, you'll just be able to click right there and access to get to that web page. All right, just some basic information on academics. So pass, no pass is an option for classes. You can either get letter grade or pass, no pass. So PN or PNP are not accepted for requirements when it comes to medical school or other health profession schools, nor are they generally not accepted for major requirements. But keep in mind that for requirements for professional school, you're going to want to get a letter grade. Schools may change their requirements between today and when you decide to apply. So just keep in mind that some information that you might be seeing, today or this year could potentially change in the next couple of years. We strive to stay on top of it as much as possible, but it definitely can change per school depending on the year. So keeping that in mind. Most schools, medical and other health professions are not concerned with the amount of units that you take in one semester or if you take courses in the summer. So what's really important is to take a manageable course load. Med schools don't necessarily need to see that you're taking 20 units and it's all in STEM and that proves that you can do a rigorous course load. What's really important is getting good grades and being academically successful, having a strong GPA. And so keeping that in mind and just remembering that you don't need to overload yourself in your semesters. It's okay to take your time. Having a double major or minor is not necessary to make you more competitive. That might be kind of a myth that a lot of people think that having like a science major or having a minor is something that is necessary. And it kind of goes similar to what I was mentioning before about the course load and doing things that are interesting to you and that you're going to be successful in is what's the most important. And then for certain health professions programs, there are some classes that might be required that are not actually offered here at UC Berkeley. For example, animal nutrition, if you're on a pre-vet path, or developmental psych. But these are classes that could be taken elsewhere, and we could help you kind of navigate where you might take those if that's the case for you. A note about AP credit. So some med schools accept AP credit to satisfy pre-med admissions requirements, but many do not. This is one of those things that changes over the courses of years. So, it's one of those things where you're going to want to review specific school websites. Most schools do not accept AP credit for science classes. So that's going to be like bio, chem, physics, math. You're going to want to make sure that you take those here at Berkeley if you've matriculated into, your first year here. And even if a school does accept AP, you will be a stronger candidate by having a college course grade for these classes. So yeah, keeping up to date. There are databases and websites that share what schools accept and what they don't accept. So that could be something to look into down the line. And then community college courses. So most health professions programs, including medical school, will accept certain courses taken at the community college. So this could be an example of, maybe a course isn't offered here at Berkeley, or maybe you're home for the summer, or you're just kind of looking to kind of diversify your classes. But if you are here for 4 years, it is recommended to take all of those science requirements at Berkeley. And then some other requirements like statistics, psychology, and the English requirement is okay to take at the community college. And then, as I've mentioned, some classes might not actually be offered here, and so those are definitely okay to take at the community college. Okay, so I've kind of shared some examples of prerequisite courses needed, and this is the medical school requirements. Other health profession schools may require a lot of these similar classes, and we have specific requirements for each type of school that's listed on our website. I want to reiterate that you don't need to memorize this right now. You can always refer back to it as you're planning for your semesters, and we can always help you kind of confirm that as well. But just generally speaking, it's going to be 1 year of bio, 1 year of physics. This is our chemistry sequence here. If chemistry is new to you, we recommend starting with Chem 32. It's kind of an intro class, and then an upper division biology course of your choice. Majors like engineering or chemistry have variations of these requirements. And it's important to note that you don't need to take all of these classes right away. You can spread them out throughout your time here. So don't feel like you need to kind of front load them all in your first couple years. And then some recommendations would be that 1 year of English, 1 semester of stats, and 1 of calculus, and then 1 semester of psychology, sociology, or anthropology. So that's a social and behavioral science type class. All right, so one thing that you don't have to necessarily worry too much about right now as an incoming student, but something to keep on your radar that's necessary for professional school admittance are exams. So you may have taken the ACT or the SAT to get into, undergrad, but for a professional school, there are additional exams. So the MCAT is for medical school, the DAT for dental school. The GRE is for other programs such as veterinary school, as well as nursing, physical therapy, and physician assistant programs. Each of these programs might even have more specific exams in order to gain admittance into their school. So one of those things is just checking out which programs you're interested in and ensuring what those exams are. And then just kind of my last note on this is planning and preparation are going to be dependent on your application timeline. Okay, so I'm going to get into extracurricular activities. So these are things outside of your classes and your academics. One thing that students do like to get involved in is research. It's generally not required to have research experience for medical school or other health profession programs, but it can be valuable and strengthen an application. And I think what's important to note is what skills or competencies will you be gaining by doing something like research? So this kind of second bullet here, it can provide training to students on how to think critically about an unresolved problem. And then if you are interested in research here on campus, we do have a department called the Office of Undergraduate Research and Scholarships, or OURS. And I'm not going to highlight every program that they offer, but there is one called the Undergraduate Research Apprenticeship Program, or URAP, you might hear it be called. And this really provides an opportunity for Berkeley undergraduates to work with faculty members and research staff on research projects, develop those skills, and really kind of learn more about an area that might be of interest to you. Another way students get research is through reaching out to professors. So this could be a professor that maybe you took a class with, or maybe someone that you know about that has some research experience or subject matter that's really interesting to you. You can reach out to these professors and ask if you could support them in any of their research upcoming. If you have any more questions or kind of want to talk through how you might go about emailing or reaching out, or what you would say to a professor if that's something that you wanted to ask about, we can certainly help you kind of brainstorm how to do that, best practices there. And then one thing I did want to note too is that research can be in disciplines outside of medicine. So you could do it in psychology, public health, or public policy. So it doesn't necessarily have to be medical related. It can be kind of thinking about like what skills or competencies are you developing, rather than necessarily what's the subject matter of the research. Okay, another important extracurricular activity, or bit of experience that could be really beneficial is clinical experience. So this is experience that involves interacting with patients and their care. These come in a variety of different forms and can be volunteer work, paid, part-time, full-time, internships, or work even done in the summer. Um, some examples of paid positions that you maybe have heard about before are hospital scribe, EMT, medical assistant, CNA, or certified nursing assistant, pharmacy tech, emergency room tech, phlebotomist. I do want to note that some of these do require certification or a certain amount of training. So keeping that in mind as you kind of maybe prepare for one of those, is to give yourself enough space and time to, train. A lot of students might do these positions over the summer, part-time during the school year, or even during a gap year after they graduate. One thing we'd recommend is to get started with volunteer opportunities at local clinics, hospitals, and nonprofits listed here on our website. So yeah, that link is right there. And on that specific link, we do have some clinics listed, some examples, and I just wanted to share and highlight some of them here on this slide. Some are in the Berkeley area, or the surrounding Bay Area, but just kind of want to put these on your radar as places to kind of get involved, maybe part-time, short-term basis. But they do offer, free health and social services to underserved populations in the community. The types of services can vary. It might be, there might be some legal services. It might be, checking people in for appointments. It might be, giving them certain tests. But this is a great way to gain experience in service and patient care. So, clinical experience is one thing that some programs, might require, but they definitely look at it as very valuable regardless. And so Whether it's valuable for your application, it's also very important for yourself. So some reasons why clinical experience is important is that you're able to really find out more about the life and the role of a physician. You may have experienced it in other ways, but to really be able to kind of get that firsthand field experience could be really eye-opening and insightful in order to clarify and validate, your desire to want to go into the field. It can help you to understand the realities and limitations of medicine, learn about the patient experience, and understand the impact of a physician, discover likes and dislikes, and enhance personal motivation, as well as improve the articulation of goals. It's one thing to maybe see a career or, research it online, but really being able to get that experience in the field is really going to help kind of solidify and, provide insight into what you would want to do as a career. Another type of experience that I want to talk about is shadowing. So this is when a physician allows you to follow them throughout their day as they see patients and do more of that behind the scenes work of medicine, like documentation or what it might be like to work with residents. And again, this is another way that's beneficial to gain exposure of that day-to-day kind of work life. It's not required for med school, but it can be required for other health programs like dental, vet, and physical therapy. And the amount of hours that you would need of shadowing are school specific. One thing I do want to mention is that shadowing is not considered patient care experience. So while it might be a type of clinical experience, it's not direct patient care because you are working mostly with the physician rather than actually with the patient. So, that's why I've mentioned getting that hands-on experience is important to see whether or not you enjoy working directly with patients. All right, some other examples of extracurricular activities could be leadership and other involvements. So not all activities need to be medical or health related. As I've mentioned before, doing activities that you enjoy is really important. Activities and hobbies outside of your academics or outside of, medical or health related things. Also, committing to activities for a year or more can show commitment to a job, an organization, and a lot of health profession schools really do like to see that. You can find leadership roles at clubs on campus or through other positions. We do have student-run clubs here at UC Berkeley. I provided a link right there to check those out. One thing I will note is that some clubs on campus are a little competitive to get into. They might require interviews or references. They might also require you to be a sophomore. So just keeping that in mind as you're exploring some of the clubs on campus. And then other ways of, getting involved or, kind of creating well-rounded experiences through other jobs and positions in which you're building skills and teamwork, communication, critical thinking, among others. Okay, so I did mention something about a gap year and maybe having one of those certified jobs, during that time. So just want to highlight that the majority of students actually do take 1 to 2 years or even more off between undergraduate and graduate programs. You do maybe hear of students going straight from senior year to a grad program, but it is also very common for students to take some time off. One reason is that it's just hard to do everything in 4 years. In terms of getting clinical experience or, other experience that you might need as you're doing your academics. So it just might be important to kind of take that extra time to gain experience and become more of a competitive applicant. One example is that physician assistant or PT physical therapy programs do actually require a certain number of patient care hours, patient care experience, like I mentioned, before submitting an application. And so a lot of students pursuing those paths might take off those gap years to gain those hours. And kind of something I've been echoing is that every student has their own path, and there isn't one linear way to get to your career or to get into a health profession school. So, every pathway looks different, and I just encourage you to kind of reflect on what feels right for you and what feels manageable for you. Some campus resources that I want to highlight: Berkeley Career Engagement, as you've learned about today, your academic advisors, college and major, peer advisors. So these are other students that are employed by departments on campus, such as Berkeley Career Engagement, your college, or the departments that you're interested in majoring in. So there are students who are part of those departments that provide guidance and some types of advising. So that's a really great way to connect with other students who are going through a very similar thing and can kind of relate. I've mentioned the Office of Undergraduate Research, the Student Learning Center, and then the Berkeley Oasis Center, which is actually where the student clubs and organizations that I mentioned previously are housed. And so one event I do want to highlight is Calapalooza, which is essentially a student organization fair that happens this year. It's going to be on Thursday, August 29th. And students will be tabling outside, representing their student organization or club. So if you're interested to see kind of what clubs are around and what it might be like to join them, that would be a really great event to get started. Okay, so to kind of broaden our understanding of Berkeley Career Engagement services and resources, I've mentioned we do pre-health application planning and timeline, but in addition to that, we offer support in just career planning and exploration in general. Maybe you don't know exactly what you want to do, and that's totally okay. We're here to meet you where you're at and have conversations to kind of help maybe reflect and create some goals. We provide review on resumes, cover letters, and personal statements. We help students prepare and practice for interviews. I mentioned the pre-health planning. We offer internship and job search support. We have interview rooms that you can actually reserve. So if you're feeling like you don't have a lot of private space, maybe where you're at, you can certainly book a room and have an interview in private. We have a free professional headshot photo booth located in our lobby. So feel free to just drop in, come by, take a photo. You can add it to your LinkedIn profile. We have career fairs and other networking events, as well as workshops. So how you can engage with us: you can ask a quick question via email at priyahealth@berkeley.edu. And then probably the best way right now, or starting in the semester, to actually meet with us one-on-one is going to be our drop-in hours beginning the first week in September. So Mondays are going to be at Mulford Hall from 2 to 4, Tuesdays at Valley Life Sciences from 2 to 4. And you probably don't know where those are right now, but you will when you come to campus. Our website right there. And then starting October 1st is when first-year students will be able to make 30-minute appointments. Right now, we have a heavy load of students who are in the application process for a lot of these programs I've mentioned. So we're kind of dedicating a lot of our appointment time to them. We do offer virtual and in person, and then we're located at 2440 Bancroft Way. And then I did want to mention Handshake, which is the platform that you're able to make appointments with us, register for events like career fairs and workshops. And you'll get more comfortable with Handshake as you begin. Some career fairs here that we put on. This is this fall. We tend to put on a lot of career fairs each semester. So, keeping this in mind as you continue as a student here. Two I might want to highlight is the business and public service on September 12th, as well as the graduate and law school fair, October 9th. So a lot of like graduate professional programs might be at that one. And then some. Did you have something here, Mom?
You cut out.
Oh, sorry about that. Yeah, so what I was saying is two I wanted to highlight on this page was the public service on September 12th and then the grad fair October 9th. You don't need to feel like you need to go to these fairs right now as a first year student, but if you wanted to see what they're like, I definitely encourage it. Did I cut out again?
I gotta find them.
Did I cut out again?
Motionless. Yeah, you did.
Okay.
You've been cutting out. So
So you were just making the point that they don't necessarily have to go to these fairs, but it might be a good idea because.
Mhm. Yeah, thank you. So yeah, and then one thing is our career mail. This is for updated and recent information regarding pre-health, resources, events, and advising. So these are some instructions to register for career mail through Handshake by going into your career interests and selecting health and medicine or any other ones that might interest you. Follow us on Instagram as well at Cal Pre-Health. We'll be putting up things that are, recent, relevant for pre-health students. And then, yeah, you can email us at prehealth@berkeley.edu. Okay, so that concludes the portion of the Berkeley Career Engagement presentation. So now I'd like to welcome Artie, if he's here, to talk about the School of Optometry.
Awesome. Yes, I'm here. Give me 1 second. Let me just share my screen. Can everyone see that all right? Awesome. Thanks so much, everyone. I hope you're having a great time this afternoon, learning a little bit more about campus resources and a little bit about what we do to support you all as undergraduate students. My role is a little bit different. I work for the University of California, Berkeley's Herbert Wertheim School of Optometry and Vision Science. Essentially, we are the only optometry program in the entire UC Health system or UC school system, and we're the only health profession program on campus. So I'm really appreciative and happy that your advisors here have given us some time, excuse me, to talk to you a little bit about our program and just to kind of introduce you into other avenues of health professions and medical programs that you might not have considered prior to almost starting your time here at Berkeley. So just want to talk a little bit about the school and what we do. So it's always good to start at a very high level and really understand, and hopefully you all know a little bit about the field of optometry. By a show of virtual hands, who has ever seen their optometrist? Anybody? Yeah, cool. A good chunk of us, yes. I know I don't see everybody's faces, but I imagine some of you all might be wearing contacts, some of y'all might be wearing glasses. And that's typically the common way that most folks learn about this health profession, either through seeing their optometrist, being connected with one, either due to vision issues or vision correction or anything along those lines. While doctors of optometry are definitely highly known for that, here's the definition from the American Optometric Association. They are the leaders in primary eye healthcare to help patients and their families take their first step towards healthier eyes and healthier bodies. If a disease or other conditions are detected, doctors of optometry can help navigate patients to the right prevention plans or the next steps in official diagnosis, and treatment. It's a very broad profession, all situated around focusing on the eyes and vision therapy, vision support, and vision science. So quite often we get confused with ophthalmology. I heard Emily talking a little bit about taking gap years and getting better prepared for any like health profession or medical program that you might be considering. Quite often we are confused with ophthalmologists. Ophthalmologists are eye surgeons, so not the primary eye care doctor, but more so specializing in more invasive surgeries as it relates to eye repair, vision correction, things along those lines. You'll see that there's a little bit of a difference between the timeline and education between the two. As you go through your undergraduate degree, you would both pursue, an optometry is 4 years or medical school is 4 years. Where there's a key difference between the two programs is residency is optional for optometry, meaning it's only 1 year and you don't have to do it if you don't want to, versus if you wanted to pursue ophthalmology, where you're specializing in eye surgery and eye needs. Along those lines, you have to be partnered with surgical residency and fellowship that is ophthalmology listed, and that usually is an additional 4 to 7 years, depending on what your program looks like and what your timeline looks like. So why do a lot of folks choose optometry, or at least consider it when they're going through their undergraduate degree? It's that amount of schooling that I just talked about. It's that work-life balance. I know that you all probably have not seen your optometrist. For those that have seen their optometrist at 1 a.m. in the morning, that's a little late. What's great about optometrists is that they have a great work-life balance. If they work in a private practice, clinic setting, educational setting, they basically set their own hours typically, and it's always typically mainly during working hours. It's a non-invasive medicine, so if you're like me and do not like horror movies with a lot of blood and gore and all that kind of stuff, this is a great opportunity for you to pursue a health profession and never really have to do any invasive medicines like that. It's very rewarding. So a lot of optometrists see the satisfaction with their patients right then in that chair. They don't have to follow up in 3 months or 6 months saying, hey, come back and let me see if your eyes improve. You improve people's eyes and vision right then and there during the appointment. There is a lot of modes to practice optometry, so more than what you might typically think. It's much more than just saying 1 or 2. And there's a lot of things that you can specialize in, ranging from things to like ocular disease, contact lenses, low vision, pediatrics, vision therapy, and others in between. But just to kind of give you a sense of how it works, at Berkeley, it's 4 years. We're a smaller program, roughly around 60 to 70 students a year. It's a combination of lectures or didactic coursework and tests and exams and clinical training. So that's working with the equipment, doing a standard eye exam, and learning advanced methods in the patient exam room with each other, and then subsequently with patients afterwards. At the end of the 4 years, you're an OD. A lot of our students go into those modes of practice right there that I've listed. And we are now 101 years old as a school here at Berkeley. So we have a lot of loyal, engaged alumni that will come support the program. One of our key advantages, as I mentioned earlier, is that clinical side. You actually start that earlier than other students. So if you want to get a sense of how to get your expertise in an exam room, learn all the equipment earlier than other optometry students, you get to do that at Berkeley because they start clinical learning day 1 and they meet with real patients year 2 rather than having to wait until year 3. And this is a great snapshot to kind of help you all visualize sort of what a 4 years in optometry school would look like. What's great about optometry school is that in the 4 years, you not only take care of your lectures and your didactic courses, you take care of your clinical training, and typically you also take your board exams in year 3 and year 4. So you don't have to wait after graduating to then take your board exams to then practice. You can do that right then and there once you're done with school, which is awesome. So I recognize you all are just starting out your Berkeley journey, but if you ever want to get connected with us and learn more about this health profession, there's a number of ways that you can do that with us. The first way is to always email us or go to our website and find our advisor form. Me and another one of my colleagues do one-on-one appointments for anybody that's interested in applying into the program. We do have Friday visits that I'm going to post up really soon. It's an opportunity for you to come to Minor Hall and Minor Edition. That's where we're located on campus, and take a tour, talk with me a little bit more, and shadow one of our pre-clinic classes, which I just got done talking about, where students get to practice on each other, their clinical skills. We have a preview date coming up on September 7th, which is basically like an open house. If you're feeling like you have somewhat of an interest in it, it's a great way to learn more about the profession, admissions processes, and learn more about our program. Our pre-optometry club, named Foresight, is a club that you can join as early as now if you want to learn more and get more knowledge about the field of optometry. They host a fall conference every fall, and theirs is going to be on September 28th, so at the end of September. We have OptoCamp, which is a great summer program to learn more about the field of optometry. We have monthly webinars where I'll spend a lot more time on the slides and talking about our program in the field of optometry and admissions. And then on our website as well, we have a newsletter called Blink. It is designed for prospective students. So if you want to learn more about our program, learn more about what's happening at our school, you could always sign up for that. And we email you just once a month, as long as you're on our list. But want to thank you all so much and see if you have any questions. But if you don't, it's okay. I know you're just getting started. But what I want to do as well is put my email and the link to our open house if you'd like to attend and learn more about optometry. But thank you, Emily, for giving me some time today.
Thanks so much, Artie, for presenting. So if you have any questions for Artie, for the sake of time, you can put them in the chat or email him. We're now going to have Marianne and Ben share about the Biology Scholars Program.
Thank you, Emily and Irma, for having us today. Let me go ahead and start sharing my screen. Can everybody see that? Yeah, okay. Thank you. Thank you again. My name is Torres. I'm one of the program advisors for the Biology Scholars Program. My program advisor is also here with me. So Ben, do you want to introduce yourself super quickly?
Sure. My name's Ben Curbs. I'm from rural Kansas. I was a first-gen college student there. In university, I studied botany and also went on to study that in grad school and taught plant science for a couple of years in SF. And last year, I transitioned to the Biology Scholars Program here at Berkeley, which has been a fantastic experience. And with BSP, I'm an advisor, and like Marianne, we help students with a wide variety of, academic and life concerns and challenges. And I also coordinate our study groups, which I'll talk a little bit more about later on.
Thank you so much, Ben. And yes, Ben will give us all the insight on study groups, which is one of our bigger resources. And that's essentially what we want to get you familiar with today. So what is BSP? And for the sake of time, I am a BSP alum. And so that makes me a little bit more of an insider expert because I did have the privilege of being able to participate in the program when I went to Cal a couple of years ago. So what is BSP? So it's a community with a ton of resources. We are a program for Cal students with a passion for biology. We do serve first generation underrepresented minorities and low-income students, but you absolutely don't have to meet any of these identities to apply. As long as you are a good community member and have a passion for science, you would fit right into our spaces. So what are some of our resources? If you do apply an interview and are admitted into the program, you have access to all of these resources. And one of our compilation of resources is a resource guide where you can find a list of all the things that we're going to cover today. The other big one, it's a community favorite, is advising. Like Ben said, we do help students in all sorts of things. We do serve a large population of pre-med students, so we are pretty well versed in pre-med activities, and we're also super lucky to have our connection at the Career Center and be able to refer you, warm hand you off to the Career Center, Emily or Irma, if we have any questions that we are not able to help you with. And in the advisor office, it's not only me and Ben, but we also have peer advisors. We usually have 2 to 3 student workers who are also here to guide you if you have any questions related to all things being a student at Cal. Like Ben said, we do have study groups. We have 9 study groups. Ben will cover that a little bit more in detail, but we offer Chem 1A, Chem 3A, Chem 3B, Bio 1A, Bio 1AL, Bio 1B, MCU 102, which is biochemistry, Physics 8A, and Data 8. Like I said, we're going to talk a little bit more about this later, but just wanted to introduce you to that as well. And if you're not taking these study groups, we also have a study buddy sheet in which you essentially sign up and are able to connect with, and you're accepting to be connected with as well, other students in your classes. So even if you're not taking some of these quote unquote introductory courses, there is opportunity for you to form other study groups. My personal BSP favorite is the BSP room, which is a study space on campus in which you have access as long as the building is open, and anyone in the program is welcome to use this space. It's like 50-50, I would say, is a social space, but also a place where we get things done. So that's a really nice perk during finals week when all the libraries are super packed and all the private rooms are already booked. This is a place where you can go and almost be guaranteed that you'll be able to find a welcoming, friend and someone that will be happy to share a snack with you. So that's always much needed during the semester. We do host a ton of events. We're going to be talking about that as well a little bit more later, but we have professional workshops. We often have like UCLA School of Medicine Prime come talk to us. We have socials. This week we had a trip to the botanical garden. So we do a lot of community engagement, and we understand that balance is important. So we'll also have some, like, we've had yoga in the past. So we tried a little bit of everything because we do think that you're more than just a student, you're also a person. So we like to cater to those needs as well. And the student community, I will say, was something very important for me. It was a safe space away from the hyper competitiveness of your classes. And it was also a good place for me to seek support where I needed. So we as staff are always here to support you. The BSP community is also here to support you. So it's just a nice place to be when you need extra help or when you're thriving to share resources as well.
So here at BSP, we have about 9 study groups, like Marianne said, each with about 2 tutors, or study group leaders, as we call them, who provide, extra support in a lot of the challenging courses that you might take as a pre-health student. Our tutors are trained in the science of learning and teaching, in pedagogy, and they offer, just like a more in-depth learning experience than what you might get just listening to lectures. They use a lot of active learning, and they build problem sets for students to really get some firsthand, practice in their courses. And our study group leaders are also usually like pretty caring people as well. And that's another great benefit of these groups, is that they're also places to make friends, to connect to the community, find fellow study buddies, and so on. Also, I'll just add, many of our students who go to these study groups say they benefit so much that they eventually want to become tutors themselves and give back to the community. So we do sometimes have paid tutoring positions available for BSP members who apply, and you can meet some of our current study group leaders there if you'd like, in the chat. And Marianne, the next slide would be great. So we have some other resources that I'll share beyond the study groups. One of those is a test bank, and this is organized by our data manager, Leslie. And in our test bank, we have hundreds and hundreds of exams from previous years that BSP members can access and find additional problem sets to help you when you're studying. Under the research and internship programs, you'll see we also have funded research or professional opportunities. One of those is Compass, and Compass is a stem cell focused research program, and it helps students prepare for careers in regenerative medicine. It involves matching students with mentors in various labs here at Cal. And by the way, it's a paid program, and it's a research program. And Emily talked about the value of research earlier. And it's for 1 to 2 years long. And here we go. Here's the link for Compass. And also earlier, Emily talked about shadowing and the value of shadowing. And we also offer a program called BICEP, and that's BSP's clinical exposure program. That's a week-long medical shadowing program that helps students, especially students who might not be totally sure about a career in medicine, decide if they would like to pursue that field, especially by allowing them to experience sort of the day-to-day work of physicians, and that's at a pulmonary clinic at the Zuckerberg Hospital in SF. And I just put a link there. I'm bombarding you with links. Lastly, you can see all of the things that we are up to and see some of the students who are in these programs by going to our Instagram page. So feel free to follow us on Instagram at Berkeley BSP. There's another link for you. So I'm going to pass it back to Marianne now.
Thank you. Yes, and just piggybacking off what Ben said, you can 100% find all the things that we are planning on hosting or the things that are coming up on our socials. So do check that out. And to circle back on the types of events we host, we do, if you are admitted into the program, you are required to attend new student orientation, which is usually at the beginning of the semester. And then towards the middle of the semester, we do have all student meeting, which is where like all 300 of the current BSPers are required to come together as a community, and we have some important conversations and do a little bit of socializing. And then we do plan social events throughout the semester. We will usually have like a hiking day, a boba day. We've done karaoke. Close to Christmas, we'll do like ornament decorating, and we do celebrate, you know, graduating seniors each semester. So that's always really fun, good community engagements. And we do have professional workshops. Like I said, we'll have UCLA Prime student panel, we'll have best study methods, and so on and so forth. I did talk about the end of semester celebration. We do like to honor our graduating seniors because that's always a big accomplishment. And then for the folks that are involved and interested in study group, and they're going to be hosting study groups this upcoming fall or spring, there is a teaching boot camp for that. So now the moment that probably everybody's been waiting for, and I'll pass it over to Ben to talk a little bit more about this.
Yeah, so Marianne and I just really warmly invite you to apply to the Biology Scholars Program. Our applications are open right now, and you are welcome to start that application if you're thinking to join. Our whole team that we have puts a lot of effort into reviewing applications, so definitely take your time and put your heart into the application. You know, don't use ChatGPT, not that anyone would do that. And if we could offer any tips, it might be to just really spend some time reading more about the mission of BSP. There's a lot of material on our website, including videos of BSP's founder, John Matsui, giving various talks and presentations. It's a really good way to dive even deeper into the program if it sounds like that it would be interesting to you. And I'll include in the chat another link, which is the website to apply to BSP. And Marianne, I think next slide. If anybody has any questions, we're at time, so I don't know if Emily and Irma will allow us, but I will also put in the chat yep, there it is. You got it. So you can write to the Biology Scholars at Berkeley, which would go to all of us, or if you have an individual question for Marianne or for me, please feel free to reach out and send us an email. And thank you all for your time, and thank you.